Once we diagnose ADD or ADHD, the treatment is really twofold, threefold actually. First is educational. These children need more structure, discipline, and consistency. And that's really the first thing to do.
So some kids, it might be all you do?
That's right. That's right. Some kids, all they need is a little bit of structure and discipline, and they do very well, and their attention gets better as they get older. And that's really the first step.
What percentage of kids truly diagnosed you think would be better for just better structure?
Well, I don't know that answer. I'm not sure that anybody really does know that answer. ADHD is a little more complicated than just taking a percentage, because some children with ADHD have other issues too. They're more likely to have learning disabilities, depression. Again, most of them don't, but if you take, they're more likely than other children to have other issues, obsessive compulsive behaviors, tics. So it's a very complicated disease, or constellation of symptoms. So I don't really know the percentage, but the first step, I think, is to give structure, discipline, consistency, and then in part to pick and choose your battles.
And if you were going to treat the kid, how would you treat the kid?
Well, picking and choosing your battles, sometimes some behavioral interventions for the parents and the kids can be helpful, in that sometimes children have a hard time doing a certain task, and if a parent keeps pushing it, all you're going to do is get resistance, and there should be certain structure to that. And then after this, if a child is falling behind academically or socially, or if they're getting frustrated and feeling badly about themselves because of the ADHD, those children sometimes do best with a crutch, and the crutch would be medication.
Of the medicines, there's different types. Can you just talk a little bit about the different types of medicine?
Sure. The first line medications that we use are the stimulants, and they include such things as Ritalin, Concerta, Adderall, Dexedrine, Focalin. These medications are very similar, have similar mechanisms of action, and similar side effects. They work very well in a child with ADHD for the time that the child is on it, but of course in some children there are side effects. I should stress that there is no evidence that these medications have a long-term effect. In other words, if I put a child on Ritalin, it's not that that child's going to be a better student when they're 18. All it affects is when you're on the medication in terms of testing or the like.
If we start medicine, does it mean it's for life? Can it be stopped? What's your...
Yes, medicine, as I said, the course of ADHD for most people is one of improvement.